How much will healthcare cost you in retirement? Well, here to talk with me about that is J.O., author of Maximize Your Medicare. Jay, welcome.
Bob, thanks for having me.
Pleasure. So, the Employee Benefit Research Institute recently published a report outlining how much retirees would need to have set aside to pay for decades of healthcare costs in retirement. Tell us about it.
Well, I like the way that they've presented it, first of all. They have stated amounts for different people, whether or not they were single or as a married couple. And nevertheless, of course, the big numbers are in fact stunning, meaning that these are numbers that people don't necessarily realize about how big they would be when you're in your 50s, when you're in your late 50s, and Medicare is not on the horizon necessarily. You're working, you're you get health insurance coverage from your employer, for example. So it comes as a shock, and for that alone, I think that these are very useful, relatively speaking, impartial reports, studies, and the numbers, of course, are then stunning. And just as an example, for example, that a 65-year-old man, a single man, would have to have saved $96,000 in order to have a 50% chance of meeting all their health care costs. To have a 90% chance of meeting all of the health care costs under retirement, that would be $166,000. Obviously, an enormous number.
And the most enormous number is for couples who would want a 90% chance of paying for all their healthcare costs in retirement. That number came in at 383,000.
What they did here is that they actually compared a couple who didn't have enormous prescription costs, and that came in at 318,000. But then they stretched the rubber band and said, okay, for those couples that do rely on high prescription costs, 388,000 for that married couple in order to have a 90% chance of meeting all of their healthcare cost needs.
So I think it's important in both this report, the EBRI report, and other reports like the Fidelity report, it seems to suggest that you would need this amount of money set aside at age 65 to pay for years of future healthcare costs. How do you parse that? What's your thought on having people sort of think of it as a net present value of costs?
Sure. I think, first of all, that it's good that people have an idea of the context about how big the numbers actually are. Like I said, when you're working for a large employer, you kind of gloss over the number. You don't have a ton of control over it. A number gets deducted from your payroll check. So having these types of numbers up front does allow people to have a more realistic view about just how high healthcare costs can be. And then in addition to that, what types of resources they will need in order to plan for their retirement years. Now, regarding the big number and the fact that they have presented it all up front, I don't want to be alarmist either. While notably those numbers are large, the fact of the matter is you're not paying them all up front today. They're going to be hopefully good years where you are in very good health, no health issues, don't get sick. They're going to be bad. These numbers still ultimately are averages. And also, they're kind of telling you a scope and scale, but they're not really talking about the timing. So I don't want people to run around believing I need this entire amount today. That's clearly not the case.
Right. And it would strike me that folks, if you break this down into an annual expense, it becomes perhaps a little bit more manageable. You're paying maybe for some of these costs out of your Social Security benefits or your pension or your IRA, and maybe you're paying for some of these other costs out of your emergency fund. Is that worth noting that these are, again, if you break these down into annual costs, it becomes a little bit more palatable for folks?
I think that that's absolutely the case, meaning that the nature of where you're going to spend your money in retirement years is different. Most of the time when we are middle aged, we are actively working. Our main focus is on career and accumulation. But now it's kind of a different, it is part of a different mindset when you're talking about creating liquidity in order to cover expenses, both those you expect and contingency for those expenses that you don't expect.
Yeah. The report also mentioned, Jay, the amount of money that the average person who had a Medigap plan would need to have set aside to have a 50% chance of covering their medical expenditures. That came in at about 212,000. And they also talked a little bit about how folks who are enrolled in Medicare Advantage plans might need to save a different number. So maybe talk a little bit about that.
Right, without delving into each one of the combinations, I think that what it does point out, which is not receiving very much attention, is that most of the numbers we have discussed, all of the numbers we have discussed, are numbers presuming that the couple or the single man that we started this with, that those persons were only on Medigap. So the reality is that there's another path, Medicare Advantage, 30 million people on Medicare Advantage. And EBRI did, for example, in the single man's situation, a number that was $70,000 lower than the 161,000. So you can understand that this is why I encourage people to just think very carefully about their resources, their source of income over time in aggregate, like you said, on an annualized basis. Because obviously for a certain person, $77,000, well, $77,000 is a lot of money to anyone. And to those people who rely on every dollar to meet their monthly living expenses, that can be enough, meaning that it can be reason enough to choose Medicare Advantage instead of Medigap. So you have to do it carefully, in my opinion, case by case basis, location by location basis, and think through your priorities so that you can make this important choice in Medicare.
Yeah. I'm always reminded when people talk about averages about how when people say a river might be on average 4 feet deep and it might be right 1 foot deep at the edges and then 15 feet deep in the middle, but on average it's 4 feet deep. And so people need to, I think, as you sort of clearly said, they need to think about the type of insurance that they choose. Because no type is typical, and it's important to think about these as averages, but also to apply them to your own situation, given what your plan might be, what your expected healthcare costs might be, what your longevity might be, etc.
Absolutely. The very nice thing, the very graceful thing about Medicare, of course, is the fact that your access to plans, Medigap, Medicare Advantage, is not limited by your household net worth. You get equal chance, equal opportunity to select these plans under the presumption, of course, that you know how to handle or are informed about how the plans actually work.
Yeah. Jay covered a lot of ground. Anything we missed?
No, I think that that's it for now. I do think that as it currently stands, it would be almost impossible to suggest that the cost of healthcare in the United States is about to reverse course and decline. So given that caution as well as staying updated, very much in order.